Okay, guys, so today we're going to have a quick discussion on how to write a short note on ESR. So ESR is basically erythrocyte sedimentation rate. This is not only a short note, but also a very important Viva question. So please be very clear about it. So first, whenever they ask you anything in the exam, you should start with the definition. So what is this? The name itself says erythrocyte sedimentation rate. That means what does it measure? So it is a measurement of sedimentation of the red cells. Obviously, it cannot be infinite. So you have to measure it at a time point, isn't it? So you have to measure it after 1 hour. So you have to let the blood stand, and after 1 hour, you have to see how much red cells have fallen down. So that is what is called. Does it measure? So it is a measure. So that is what is called as erythrocyte sedimentation rate. So that has to be very, very clear, and everybody should be able to understand that. So that is your erythrocyte sedimentation rate that you have to be super clear with. Okay. Now, once you have understood this, that this is basically a measurement, this is a technique, you have to understand that we can do it in two ways. One, we have two type of tubes, Wintrobe's tube and Westergren tube. So you have to be very clear in understanding this, and whenever they give you this as a short note, you have to write the differences between both of them. So first, what is the difference? So first, what is the recommended method? So Westergren is always a WHO and CLSI recommended method for ESR estimation. That's first point that everybody has to be very, very clear. Now, when you look at the Westergren tubes, this Westergren tube is a longer tube. It's not a tube, it's a pipette. That is, it is open from both the ends, and its length is approximately 30 centimeter. So this is in contrast to Wintrobe tube, which is 11 centimeters long. So first is your length. So the length is different. Okay, so Westergren is 30 centimeter long pipette. Wintrobe is 11 centimeter long tube. Now, if you look at the diameter of this, so Westergren is only 2.5 millimeter bore, whereas Wintrobe is 3 millimeter bore. So how do you remember? So 3 will never come with 3. 30 will never allow 3. So it has to be less than that. So it is 2.5 millimeter. Now, once you're clear with this, always remember there is a difference in the scaling or in the orderly arrangement of the numbers. So I told you Westergren is a pipette. So when it is a pipette, so the numbers are only given from 0 to 20. Okay, so it has numbers only from 0 to 20. Okay, so that is the scaling which is there, and it is always from top to bottom. So that is why we can see the fall of the RBCs. Whereas Wintrobe is a tube which has markings on both sides. So one is from 0 to 10. Okay, which will see the fall of red cells. This is for ESR. But we also have marking from 0 to 10 in upward direction. And this is for packed cell volume. This is for packed cell volume. So when we talk about packed cell volume, always remember it is, what is packed cell volume? So this is basically when you take a Wintrobe tube and you centrifuge it. So when you centrifuge it, 3 layers are formed. सबसे नीचे RBC, then a buffy coat layer, and then on the top is plasma. So whenever you have to measure the concentration of packed red cells, that is what is called as packed cell volume. So that can be done only on Wintrobe's tube. So Wintrobe tube has marking on both the sides. Okay, so that is from top to bottom and down to up. So that is for both ESR and PCV. So that's the uniqueness of Wintrobe's. Okay, now look at the tube. So I told you Westergren is not a tube, it is a pipette. It is open from both the end. Wintrobe is a tube which has marking from both the side, right? So that should be clear with everybody. Okay, once we are clear, what are the uses? So hi Dinu, hi Venkat, hi Tejashri. Okay, so when we look at the side, always remember that Westergrens is basically only used for ESR, whereas Wintrobe tube is not only used for ESR, it is also used for packed cell volume, and it is also used because this, I told you, whenever you centrifuge Wintrobe tube, you will get 3 layers, RBCs, buffy coat, and plasma. So whenever you need buffy coat preparations, for that also you need your Wintrobe's tube. So that is very, very clear. So are you clear with the difference that you have to write? So this is the typical snapshot. which you should remember of difference between Westergren and Wintrobe tube, which you should write when they give you this in the exam. So always remember this. This is a very, very important question that you have to be very clear. So once we are clear with the difference in Wintrobes and Westergren, so just remember Westergren tube is 30 centimeter long, but it has markings only till 20 centimeter, and it is a pipette. It is open from both the ends, so used only for ESR. Wintrobe's tube is 11 centimeter long tube, but it has a marking only till 10 centimeter, both from top to bottom and bottom to top for ESR and packed cell volume. Apart from that, it can also be used for Buffy coat preparation. So that is about the difference between Wintrobes and Westergrens. Now, once you have written this, you have written the definition, you have written how we can do it. The next important point that you should write is how do we do it and how are they different. So let's look at the tube first. So everybody, can you see this tube here? So this is basically a Wintrobe tube. Can you see it has marking from 0 to 10? So you can see the fall of RBC. So this is for ESR. Okay, so that is for ESR. Whereas here you can see marking from 0 to 10. And this is basically for packed cell volume, okay, or hematocrit. So that is your Wintrobe tube. Whereas look at this tube here. This is your Westergren tube, which is a pipette. It is open from both the ends. It's a very long tube, you can see. So it has marking only from 0 to 20, and it is basically used for ESR only. Okay, so that should be clear. Now, next thing that you should write in your exam is how do you do it? Method. So first we require anticoagulant blood here. So what are the anticoagulants that we can use here? Okay, so what are the anticoagulants we can use here? Always remember, we can either use EDTA, okay, or we can use trisodium citrate. Trisodium citrate. Can you see this is a black top vacutainer? So this is actually 3.8% trisodium citrate, and the ratio of anticoagulant to blood is 1:4. That is 1 volume of anticoagulant to the 4 volumes of blood. So that has to be very, very clear here. Okay. Now, which method uses what? So remember, look at this. This is your Wintrobe. Wintrobe ends with E. So that uses EDTA vacutainer. Whereas Westergren uses trisodium citrate. So that is the difference between Wintrobe and Westergren tube. Okay, so E for E, Wintrobe uses EDTA, Westergren uses trisodium citrate, and that is the anticoagulants which are used here. So once we are very, very clear, so first point is you have to take the sample. Sample has to be anticoagulated blood, which can be EDTA or trisodium citrate. Number 2, you have to take a pasture pipette and fill till 0 mark. Okay, so you have to take a pasture pipette and fill it till 0 mark. Then you have to let the tube stand vertically. Now this is very, very important, because if it is angulated, then your ESR will be there will be rapid fall of RBC. So it has to be standing vertically. You have to make it standing for a period of 1 hour. Okay, so you have to let the blood stand for a period of 1 hour. And after 1 hour, you should record the fall. Record the fall of RBCs. You should record the fall of RBCs. So these are the points you should write. So method, what should you use? First, anticoagulants. Second, you have to fill the tube till 0 mark. The third, you have to keep the tube vertically. Fourth, that you have to look at let the tube stand for 1 hour, and after that you have to record the fall of RBCs. So that is the method that you should write. Now, after writing the method, you should write how will you express the result. So remember, result will always be expressed as the height of the clear plasma above the upper limit of the column. Okay, so you have to measure the upper meniscus of the RBCs and you give the height of fall. That is how you have to report, and you have to report it as millimeter of fall in the first hour. So we are not giving per hour, we are giving first hour. In first hour, how much the RBCs have fallen, that is your ESR. Okay, so millimeter per first hour. That's very, very important that you should write here. Now, what is the results? So result depends upon which tube you are using. Either you are using Wintrobe tube or you are using Westergren tube. Now everybody knows Westergren is a longer tube, so obviously your fall will be more, isn't it? So when we divide it into male and female, females usually have more ESRs, okay? So in females, usually it is 10 to 20 millimeter in the first hour. Same here also. Both of them have this much. But in males, the difference is there. So here it is 0 to 10 in the first hour. And here it is 0 to 15 millimeter in the first hour. Okay, so that is basically the difference between the markings. Okay, so Wintrobes usually give lower values than Westergren. So that is why Westergren has been chosen as a WHO standard technique for doing ESR. The second point you should remember is ESR always increases with age. ESR always increases with age. So what is that point? So remember a very simple code: 10, 8, 10, 14, 16. Okay, so that is doubling: 8, 10, 14, 16. Same way age also. So 10, 20, 40, 60. So remember, by the age of 10, your ESR is usually 8 millimeter in the first hour. By the age of 20, it will be 10. 40, it will be 14, and 60, it will be 16. So it will always be less than 20. Okay, that is what you have to always remember. So that is with age. So rule is that ESR increases with age. ESR increases with age. So that's another point that you have to be very, very clear. Right, guys? So that is one thing that everybody should be super duper clear. Okay, so that is about your results. So what have you written in the result? So in the result, you should write: first, you have to measure the height of the clear plasma above the upper limit. Second, you report it as millimeter of fall in the first hour. Third, you have to report it as and compared to Wintrobe or Westergren tubes. So remember, in males, it is usually in Wintrobe it is 10, and females it's 50. Females is always 0 to 20 millimeter per hour. In per hour nahi per first hour. Okay, remember, ESR always increases with age. That is the another point that you have to be very clear. So once you have written the technique, how do we do it? The next important point you have to remember is stages of the ESR. So there is a very simple mnemonic that everybody should remember: ready, set, and pack. Ready, set, and pack. So stage 1 is rouleau formation. So this stage is only for 10 minutes. So rouleau formation means packing of the RBC. So all the RBCs packed together. That is called rouleau formation. So here you have to remember a catch, that there is a zeta potential, that is negative charge. Okay, so every red cell has a zeta potential, that is negative charge. So it will repel each other. Normally the red cells will repel each other. So they have negative charge. So they will not come together and form the rouleau. So what happens normally is, so therefore the rouleau formation is not a normal phenomena. So whenever we have some inflammation, so some inflammatory proteins like fibrinogen or globulins, what do? They neutralize the negative charge on the RBCs. So when they neutralize the negative charge on the RBCs become sticky and they form rouleau. So that is why most of the inflammatory conditions like tuberculosis, like rheumatoid arthritis, where the acute phase reactants are increased. So what are the acute phase reactants? Like fibrinogen, globulins. So they will mitigate or remove the negative charge of the RBCs, and that is why they help in forming rouleau. So that is why you see rouleau formation more in inflammatory conditions. So that is stage 1, rouleau formation. The second stage is sedimentation. S for sedimentation. So remember what you have remembered. You have to ready, you have to set, and you have to pack. Sedimentation. Obviously, when the RBCs have formed stack, they have become heavier. So when they have become heavier, they will fall quickly. They will fall quickly under the gravity. They will fall quickly under the gravity. So that's one point you have to be very, very clear. So that is why more the heavier, more the bigger the rouleau, more the fall. Okay, so that means the sedimentation depends upon number 1, plasma viscosity. Okay, so suppose the plasma viscosity is less, so then the RBCs will fall very quickly. So that is number 1. It depends upon plasma viscosity. Number 2, it depends upon your how much big rouleau is there. Like in cases of myeloma, okay, so the rouleau is very big because there's a lot of lot of globulins which are increased. So they remove the negative charge and they form big rouleau. So it will fall down quickly. That is why in myeloma, ESR is very high. Third is RBC shape. Suppose if the RBCs are very small, microcyte, so the rouleau will also be smaller. So therefore, the ESR will not be high. Whereas if you have macrocyte, so then the rouleau will be bigger. That is why, can I say sedimentation basically depends upon viscosity, RBC size and shape, and rouleau density. Now let's take one more example of RBC size and shape. Suppose you have sickle cells. Okay, so sickle cells are like this. So they will not form rouleau at all. So when the rouleau is not there, so there's a negative charge. So they will keep repelling each other. So no rouleau means no weight. No weight means it will not fall down, not sediment well. So what will happen? ESR will be low. So if there's, suppose there are spherocytes, again, spherocytes means they will never come together and pack. They can't pack. So again, no rouleau. No rouleau means no weight. No weight means it will not fall down. So again, your ESR will be low. So if that point should always be clear. Yes. Yes, Mahibul. It's a clinical pathology lecture, that is ESR. So that point has to be very, very clear. So that is your sedimentation. Now, last is packing. Packing is the last 10 minutes that you have to remember. So if somebody asks you in MCQ also, which is the largest phase in ESR? So always remember which is the largest phase in ESR? It is sedimentation. Sedimentation is the largest phase. So rouleau is 10 minutes. Sedimentation is 40 minutes. Last 10 minutes is packing and done. So what are the 3 stages of ESR? Everybody ready, set and pack. Rouleau, sedimentation and packing. That's it. So once you have written this, next last point that you have to remember is what are the causes of increased and decreased ESR? This is one thing that you should be very clear because this can be given to you as an MCQ also, and you should know how to write this in exam also. Okay. So first starting with the increased. So always remember whenever you're writing increased ESR, first always write with physiological, then pathological. So physiological causes of increased ESR. So what is a physiological important cause of increased ESR? Most important, pregnancy. Okay, so remember in pregnancy, what happens? So in pregnancy, there are a lot of globulins which are increased, which remove the negative charge of the RBC. So there is definitely more falling down. So that is one thing that you have to be very, very clear. Okay, so that is first is pregnancy. The second condition that you have to remember is age. So as the age increases, your ESR increases. So that is second thing that you have to be very clear. So pregnancy and aging is very important. So that's physiological. Now let's come to the pathological causes of increased ESR. So first, whenever there are increased acute phase reactants. Okay, so whenever we have increased acute phase reactants. Okay, obviously, so what will happen? More globulins, negative charge of the RBCs will be removed and more rouleau and more falling down. So like tuberculosis, like rheumatoid arthritis, like temporal arthritis. So these are 3 important conditions where your ESR is very, very useful in picking up inflammatory nature. Then malignancies. So which malignancy? Remember always multiple myeloma. In multiple myeloma also, you will have ESR will be high because there is high amount of globulins. So that should be very clear. So remember what are the conditions? So in which ESR is increased? So tuberculosis, rheumatoid arthritis, temporal arthritis, and in malignancy, multiple myeloma. So that has to be very, very clear. So these are the conditions where ESR is high. Now let's go to the opposite types. So decreased ESR. So what is the physiological cause? Okay. So what is the physiological cause of decreased ESR? Okay. So Mahibul, you will find it in the app. I think by tomorrow, day after tomorrow, it is there. It is there. Okay. So it will come. Okay. So when we talk about decreased, okay, so decreased, you should always remember decreased ESR is typically seen in first neonates. So neonates have a decreased ESR. That point you have to be very, very clear. Okay, so neonates have decreased ESR. The second is pathologically decreased ESR. Please remember the code PFSC. So that is very, very important. PFSC. P for polycythemia. So what is polycythemia? Everybody should be clear. So whenever there is increased RBCs, so there is lot of increased RBCs. So much increased RBCs are there. Okay. So what happens? Plasma is less. So much RBCs together. What will happen? So obviously they will not be. So when RBCs है तो plasma तो है ही नहीं. So they'll not fall down and your ESR will be low. Second is hypofibrinogenemia. If their fibrinogen levels are low, then who will reduce the negative charge of the RBCs? It will not be reduced and the ESR will be low. So hypofibrinogenemia, again ESR will be low. Then we have talked about whenever there is any shape change like sickle cell anemia or spherocytosis, they will not pack at all. So there will be no roulette. No roulette means no sedimentation. So obviously our ESR will be low. Next is congestive cardiac failure. Congestive cardiac failure. Okay. So in congestive cardiac failure, what happens is there is edema. So edema causes fluid to move out from the vessels. Okay. So there is a lot of hemoconcentration in the vessels. So this hemoconcentration, whenever there is a lot of RBCs there, what is happening is there is negative charge in the RBCs. So they are not falling down. So this will again cause decreased ESR. Okay. So these are the points that you have to be very, very clear. Okay. So that is the important causes of decreased ESR. Polycythemia, hypofibrinogenemia, sickle cell anemia, okay, spherocytosis or congestive cardiac failure. So this is the master chart that you should write in exam whenever they give you. So increased ESR, physiological, pathological, decreased ESR, physiological, pathological. So when you finish this, when you write all of this, you get full marks in your ESR and even you answer your Viva questions. Okay. So let's quickly recap what all we have studied here. So first, what is ESR? It is just measurement of the sedimentation of RBC after standing for 1 hour. How many methods of ESR? There are two methods, Westergren and Wintrobe. Write about their length, markings, bore size, pipette, and uses. So that will complete the difference between ESR in Westergren and Wintrobes. Once you have written that, draw the two tubes, both ESR and Westergrens, and show that Westergren is a pipette, open from both ends, Wintrobe is a tube, marking from both sides. Third, write down how do you do it. Write about anticoagulants, procedure, fill the till zero mark, vertically arranged 1 hour and record the fall. Then write out how do you report it. So you read the height, you report it as millimeter in the first hour, report it in Wintrobes and Westergrens, and you have to write with age the ESR increases. Then remember the stages of ESR, 3 stages, ready, set and pack. I told you rule is 10 minutes and zeta potential ke baare mein likho. Write about the inflammatory proteins, which basically decrease this negative charge. Then write about the second stage, that is sedimentation. So more the rule, more the sedimentation. What are the factors affecting sedimentation? One, plasma viscosity. Second, RBC size and shape. Please write about microcytosis, sickle cells, spherocytosis. Write about rule densities. In myeloma, there is big rule, so more fall. And last is packing. Nothing much in that. That is the last stage. That is packing stage. Last is causes of increased and decreased. So once you write all of this, you will get full marks, right guys? So that was, I just told you I'll take just 30 minutes. So I finished on time. And that was one of the short notes which come, and it is a very important Viva question also. So guys, please revise this, right guys? Okay. So we'll finish the session here. Bye. We'll come back with more such sessions and let me know if you like it and do text me. You can message me. You can message me either on my Insta. Okay. Everybody knows this is my Insta. That is Dr. Vandana Pathology. Or you can message me on my core group for the second years also. So I'll be happy to solve your queries and any short note which you want me to explain it to you. Right, guys? With that, bye-bye. Study well. Thank you, Mahibul.